Before watching this video, click on the subscribe button.
Augmentin tablets contains amoxicillin as amoxicillin trihydrate and clavulanic acid. The Augmentin tablets are available in 375 mg tablets, 625 mg tablets and 1 gram tablets. You can see the exact amount on your screen. Whereas the Augmentin suspensions are available in 156.25 mg suspension and 312.50 mg suspension. Uses or indications. Augmentin is an antibiotic agent with a notable broad spectrum of activity against the commonly occurring bacterial pathogens in general practice and hospitals. The beta-lactamase inhibitory action of clavulanate extends the spectrum of amoxicillin to embrace a wider range of organisms, including many resistant to other beta-lactam antibiotics. Augmentin should be used in accordance with local official antibiotic prescribing guidelines and the local susceptibility data. Augmentin oral presentations for 3 times daily dosing are indicated for the short-term treatment of bacterial infections at the following sites: upper respiratory tract infections including ENT, for example tonsillitis, sinusitis, and otitis media. Lower respiratory tract infections, example acute exacerbation of chronic bronchitis, lower and bronchopneumonia. Genito-Urinary tract infections, for example cystitis, urethritis, pyelonephritis. Skin and soft tissue infections, for example boils, abscesses, cellulitis, and wound infections. Bone and joint infections, for example osteomyelitis. Dental infections, for example dentoalveolar abscess. And the other infections are including intra-abdominal sepsis. Dosage and administration. Usual dosage for the treatment of infections, adults and children over the 12 years. For mild and moderate infections, 1 Augmentin 375 mg tablet 3 times a daily, while the severe infections, 1 Augmentin of 1 gram tablet twice daily, or 1 Augmentin of 625 mg tablet 3 times a day. Where the 625 mg tablet is not available, a dose of 2 Augmentin of 375 mg tablets 3 times a day may be taken. Therapy can be started parenterally and continued with an oral preparation. For the children, the usual recommended daily dosage is 25 mg kg per day and divided doses every 8 hours. See the table for the proper dosage for children. In this table, you can see the dosage regarding the age of 1 to 6 years and over 6 years, as well as with the guidance of weight of the body. In the more serious infections, the dosage may be increased up to the 50 mg per kg per day in divided doses every 8 hours. The each 25 mg Augmentin provides 20 mg amoxicillin and 5 mg clavulanate. The Augmentin 375 mg and 625 mg tablets are not recommended in the children of 12 years and under. The dosage in dental infections, for example, dental-alveolar abscess. So the adults and children over the 12 years, 1 Augmentin of 375 mg tablet 3 times a day for 5 days. Okay, now dosage in renal impairment. So see on your screen for the dosage in renal impairment for the adults and the children. Now I'm going to tell you about the dosage in hepatic impairment. So the dosage with caution monitor hepatic function at regular intervals. Each Augmentin of 375 mg or the 625 mg and 1 gram tablets contain 0.63 ml. Now I'm talking about the administration. So minimize the potential gastrointestinal intolerance. Administer at the start of a meal. The absorption of Augmentin is optimized when taken at the start of a meal. Treatment should not be extended beyond the 40 days without review. Warnings and precautions. The individuals should take care of the hypersensitivity reactions to the amoxicillin and penicillin. The Augmentin should be avoided if infectious mononucleosis is suspected. The prolonged use may also occasionally result in overgrowth of non-suspectable organisms. Pseudomembranous colitis has been reported with the use of antibiotics and may range in severity from mild to life-threatening. The treatment should be discontinued if the prolonged or significant diarrhea occurs or the patient experiences abdominal cramps. The abnormal prolongation of prothrombin time increased has been reported in the patients that received Augmentin and oral anticoagulants. The changes in liver function tests have been observed in some patients that received the Augmentin. The cholestatic jaundice, which may be severe but it is usually reversible, has been reported rarely. In the patients with reduced urine output, crystalluria has been observed. It is advisable to maintain the adequate level of fluid and the urinary output in order to reduce the possibility of amoxicillin crystalluria. The Augmentin suspensions contains aspartame, that is the source of phenylalanine, and therefore should be used with caution in patients with phenylketonuria. Interactions. Concomitant use of probenecid is not recommended because the probenecid decreases the renal tubular secretion of amoxicillin. Augmentin may also affect the gut flora, leading to lower estrogen reabsorption and reduced efficacy of combined oral contraceptives. The Augmentin may also interact with warfarin. Pregnancy and lactation. Adverse reactions. The most common side effects are including diarrhea, nausea, vomiting, dizziness, headache, convulsions, anaphylaxis, hypersensitivity vasculitis, hemolytic anemia, and the prolongation of bleeding time and prothrombin time. mucocutaneous candidiasis, reversible leukopenia including neutropenia and thrombocytopenia, antibiotic-associated colitis, hepatitis and cholestatic jaundice, skin rash, pruritus, urticaria, and erythema multiforme. Interstitial nephritis and crysuria are also reported. Okay, so when it's about our dosage of Augmentin, so the gastrointestinal symptoms and the disturbance of fluid and electrolyte balances may be evident. So the gastrointestinal symptoms may be treated symptomatically with attention to the water electrolyte balance. Amoxycillin crystalluria in some cases leading to renal failure has been observed. The Augmentin can be removed from the circulation by hemodialysis.